Welcome back. This is Good Morning Namibia. We're continuing along the health trajectory. Now, common colds and flu are both contagious viral respiratory infections with overlapping symptoms, but the flu is generally more severe, comes on abruptly, and involves higher fevers. Colds and flu often spread rapidly in schools, especially during the raining season. To enlighten us more on how parents and guardians can look after the little ones during these times, I'm joined by one of our resident pediatricians, Dr. Landuleni Benjamin. Good morning, Doc. Welcome back to Good Morning Namibia.
Good morning, and thanks for having me.
How has 2026 been treating you and your young patients?
So far, so good.
We're very happy to hear that and very happy to have you, Doctor, as always.
Thank you.
Doctor, please talk to us about why exactly children are more susceptible to colds and flus, particularly during this time.
Okay, perhaps one can go step back and talk just quickly about the immune system. Before they are born, they have an immune system, but it's designed to tolerate, not to attack. So it's a defense. The defense is there, but it doesn't do anything. It coexists with antigens or anything that comes there. So the only protecting thereafter, therefore, is the placenta. As they grow, as they are born, they slowly develop an immune system, which takes a little bit of time. So you can imagine you basically unprepared, and that's why we vaccinate them quite a lot. We prepare them that way. But they also gain from the mother, especially when they are breastfed. Those are not breastfed, they lose out a little bit on that. But generally, they suffer from cold and flu on the basis of what happened directly. So direct is when you sneeze and you cough. You have those droplets that may spread, but also, unfortunately, indirectly when we handle certain things. So the drops may land on my hands, and as I touch, let's say, the door handle or anything for that matter, anything around the bed, the cord of the baby and anywhere else, I may spread viruses to them. So you generally have a weak system that is not properly primed to fight infection, and then the exposure that can happen at any time. You look at daycare facilities, sometimes a small room and no windows and packed with little kids, each one sneezing, etc. So those are some of the reasons why they may be more prone to infection than your general population. And unfortunately, the same things happen as we age. We become again susceptible.
Now, the default approach often is to self-medicate.
Yes.
And or to establish a pharmacy at home. Is that advisable? If yes, under which circumstances? And when is it important to perhaps seek either proper and or pharmaceutical intervention?
One has to be very careful. And in pediatric, we are always mindful of age. Now, bigger kids, you probably could get away with it, but you must be very careful. You have, let's say, 3 months or less than 3 months. You probably shouldn't be going to a pharmacy and collect medication.
For whatever reason?
For whatever reasons. Remember, one of the biggest problems, which you mentioned earlier when I walked in, is that they don't localize infection very well. So all you have picked up is fever, or that the child looks warmer. But for you to then diagnose and treat, it will be inappropriate. You need to consult someone who will examine the child, because for them, that fever may be something much more sinister than you think. And to just call them, diagnose them as someone with flu, it may not be the correct thing to do. For bigger ones, you should also be cautious how long you treat. So if you have fever that doesn't go away, which we often refer to as persistent fever, then you have a problem, because somehow you either have a wrong diagnosis, or you have a much sicker person than you are willing to admit, and therefore you should seek help. Difficulty breathing. So individuals who are breathing with difficulty, you need to try and sort that out quickly. And sometimes you just have generally congested nose, and they just can't breathe very well.
And they're uncomfortable.
And they're uncomfortable. And sometimes extremely irritable. They are crying all the time. You can't feed them, and eventually they become dehydrated. So these are some of the signs that should suggest to you that you need to, at least as soon as possible, have them checked out, and then somebody else would make a proper diagnosis and then start treatment.
How does one treat a fever at home?
Fever at home, we normally use paracetamol, is quite adequate. Others
Even administered to a newborn?
Newborns are not quite a good idea because once they have a temperature, they do have two extremes. They're either too cold or hot. The ones that are hot are slightly better because they are at least attempting to fight. The colder one, which are often neglected, are the ones that are in deep trouble because they are not mounting anything. And therefore, the two extremes once picked up, you should immediately get to the nearest health center or call your pediatrician.
At what stage should I be worried? You know, how long should I give it before I seek an intervention?
For one, it depends on how they present. How sick do they look to you? If they are not very sick, you can give it at least 48 hours. Or perhaps your extreme will be about 72, but beyond 72 would be pushing too hard. But usually, depending on the age, if they are small, as I said, 3 months or less, immediately you should seek help. You don't wait.
If they're not well?
If they are not well.
Yeah. What are the dangers if one tries to manage the situation at home?
For one, it's underestimating the problem. And if you underestimate the problem, you are likely to end up with a dead baby. And that will be extremely unfortunate because you could have done something. I think there's often reluctance to seek help, even with a child that's not eating. When you have a child that's not feeding, that on itself is a serious red flag, and you should have it checked out as soon as possible.
How prevalent is it? How often do you see it that we don't seek help on time?
Not too often, but we have seen enough. And it's really a sad situation for us because you come in with very little to offer. There was ample time to get things done and done correctly. But now you end up as a person who could have been admitted for observation and treatment perhaps ends up as an ICU case. And the outcome may be grave. And those are the things one would want to avoid.
Are flu vaccinations an option for children?
Yes, they are. Interesting enough, if you look at literature, you can start from 6 months onwards. So it actually can be given quite early. And then they work quite well. Obviously, the strains are too many, so they may still get flu, but they do much better when they are immunized versus the ones that are not immunized. But we are mindful of the stigma attached to vaccination these days, to a point that people just blow them out of proportion. Even the ones we know have been working very well for us.
And what message do you have for such parents?
Look, we know where we live. We live on the continent, and our continent still has got a lot of different conditions that are perhaps not completely eliminated. We just completed the phase of polio, and some of these things are unforgiving. If you get polio, you get polio. And your parents would wish they have immunized you, but that will be too late. We know what happened in those days when people were not immunized. They end up being crippled, some of them died. And these are things we can control. I think what people should do is to get proper information, not through Google, through people who are trained. The immune system is not as simple as people want to make it. And that's the sad reality about when they interpret what vaccine can do and cannot do. Life in itself, it offers quite a lot of risk. Just breathing is a risk on its own. Yet we make this strong argument. Most of us smoke every day. We don't see that as a problem. Most of us drink every day. We don't, but we will point to a simple thing such as vaccination. And that's unfortunate. It's rather unfortunate and unrealistic because we need to look at what the benefit versus the risk. And life is always like that. We weigh up the risk versus the benefit, and the benefit by far outweigh that risk.
How unfortunate is it if medical practitioners are the very ones perpetuating these conspiracy theories?
That is not only unethical, It's unacceptable. And I think as a profession, we ought to have strict guidelines on how to deal with such people, because you are breaking the oath that you have taken. Above all, do no harm. Now you're doing harm, and you should be taken to task.
You explained to us earlier that on account of proximity, particularly at school, these viruses tend to spread. So at what stage must I decide as a parent, as a caregiver, to rather keep my child at home when they're not feeling well, when they are presenting with some signs and symptoms consistent with what could be a viral infection?
Quite a number of school or caregiving facilities are quite good at informing parents. There are quite a lot of WhatsApp groups, etc., and they indicate so-and-so did not come to school because they are unwell. And that does help, because if you pick up too many kids that are sick from the facility, you probably may decide not to have yours attend. But be as it may, any parent who wants to send them back to school, the sort of the guide is that you wait 24 hours without fever. They should be fever-free, but that fever-free was off medication. So not that you give them Panadol and then the whole night they didn't have fever,
and you think they're
the
fine.
next day you say they are fine.
Yeah.
It should be at full 24 hours, and through that 24 hours, they should not have had fever.
Any final thoughts before we let you go, Doctor?
This is a very interesting topic, I think. And I think immune system in children is probably one of the most fascinating subjects that you come across. But I think what we ought to do is that parents have a responsibility to care and to make sure that their children are safe. So all of us are busy, but there can be no excuse for us to come home after work and not check on our children, so that you only hear the next day. I think the culture of helpers and so on has also taken away the hands-on approach that we should all have on our children. And just to remind us that hand washing is still key to all of this, making sure that people, and then obviously disinfecting areas that may pose danger, or if somebody came in coughing and sneezing, disinfecting those areas may help.
Thank you so much for those insights, Doctor.
Thank you.